our very first topic for this entire series is IVF. Is it really suitable for me? Now, there are young couples here who are probably thinking, should we go for IVF? Is it suitable for them? And why should someone consider, or a couple consider, IVF?
Okay, there are many reasons. Hello? Yeah. Okay, I think there's just to let you understand that IVF is just one of a modality to conceive. I mean, to have a baby. A lot of times, the best way is naturally, but having tried for a while, or after having seen a doctor and they found they have some problems. It might be male, it might be female. For example, some female, they may have blocked tubes, or they have like blood cysts. Or anyone where even after investigation they found no problem, they couldn't define a cause. But the idea is that we want a baby, and so this would be a couple that might be suitable. So anyone who has tried for 2 years are potentially 2 to 3 years are potential candidates for IVF.
Okay, so 2 years, 3 years to get into the role of IVF. And is there a way to prepare for IVF emotionally, physically for a couple?
Okay, I mean, I think a lot of the time is the decision making. You know, like I said, do we make this step forward? And so this has to be discussed with the doctor to see what's the problem, whether there are other simpler ways that we can overcome. And I mean, like I say, we aim to achieve natural conception. But having gone through all the medical condition and having corrected what we can, then when it's the next step, then there are a few things. I mean, physically, well, mainly we want everybody to be healthy. I mean, of a normal weight, because potentially you're going to get pregnant. So too thin, too overweight, you know, what we can do, we try to correct. And of course, a healthy lifestyle, because it takes time from work and from life, so it potentially is stressful. And so it will help to understand it, to know what you're going in for, because with more knowledge there's power, you know, knowing what to expect, because you know then I think it makes the journey a lot easier.
And from the husband or wife's perspective,
Yes.
what would it be? I mean, it's a challenge, some would say.
Okay. I think sometimes, a lot of time, there's a lot of fear.
A fear?
Yeah, because the first thing we say, you have to do your own injections, and then they're a bit worried, you know. But in reality, millions of women all over the world have undergone IVF. And what it is true, it does involve some injections, but most of our women are very motivated, they're educated, and you know, we can help them. It's just a more of psychological barrier. Then there's time off work, in the sense that, you know, you need, a lot of people think that, oh, I need 1 month off, but no, most of our women actually continue work and come for their treatment. And in the IVF center, we try to accommodate them so that they can go on with their life. Yes, husband, very important, their support. Of course, we need their sperm.
Absolutely. It seems like the guys are pretty easy. They're there to do that, and then the ladies take all the, you know, the issues.
Yes, because the procedures and all, the ladies get the brunt of it, I'm afraid.
But
so the husband's very important.
The husbands are very vital. Husbands, remember, you're very, very important.
Yes.
And speaking about IVF in its journey, what can you expect during your one's IVF journey with the public hospitals?
Okay, a lot of time you would have seen your doctor come to a decision, then a plan would be made as to what sort of treatment you'll be having. So the thing is that a lot of time there will be a lot of counseling and teaching by the nurses, and usually once it starts, it's actually quite fast. A lot of time just before your IVF procedure, there will be some investigation, basically infection screen, which is mandated by ministry.
Infection screen?
Yeah, like HIV, Hep B, Hep C. Make sure your vaccinations are up to date for German measles. We would do, like for the female, an idea of the egg reserve, so some hormone tests and scans. And for the husband, of course, they do the infection screen and the semen test as well. Once that is in place, then the decision is made of to what sort of treatment. So you'll see a doctor who explain the treatment, and you go through a consent, all right, to explain and answer your questions. And then when you're ready to start, when your period comes, you normally call the center, and the nurses will teach you how to do your injections and everything.
Of course, there's a cost involved as well.
Yes.
And I believe these are the costs. And you can find the details of how much it will cost with government aid as well in the brochures we have for you. As a Singapore citizen couple, fresh eggs.
Yes.
It's 75% up to $6,300.
Yes, that's right. If both husband and wife are Singaporeans.
Singaporeans, yeah.
On top of that, I mean, it's around about cost is about 12 to 15,000. So, but you can use your MediSave as well. You're allowed to use 15,000 of your MediSave for fertility.
How much
treatment.
is that again from the MediSave?
From your MediSave, you're allowed to use 15,000 for fertility treatment. But they do. There is a regulation. The maximum you can draw for the first attempt is 6,000. Second 5, last one 4.
Okay, and of course the frozen eggs. That's also with 75% up to $1,200. Now, all the details can be found in the brochures we have for you. If you haven't got a brochure yet, I would recommend you grab one from the booths at the sides and our friendly staff who are decked in their white outfits. Professor, what a lot of eager couples here, anxious couples as well. What are the success rates for IVF?
Okay, in a ballpark figure, we are talking about 30 over %. All right, so but actually it depends on your age. If you're young, less than 34, you're talking about 30 to 40%. Unfortunately, if you're over 40, it starts dropping. It's about 10 to 15%. And once you hit 43, it's single digit. It's a few percent. So the important message is that make your decision and try early than late. Because in the past, it used to be like a last-ditch attempt. When they come when they're 40, it's really not very much we can do because the quality of eggs and success is very dependent on the female age.
So what you're trying to say, again, is to conceive at a younger age.
That's right.
Once you get married, try early, get married, have your babies ASAP. It's as simple as that. And what could potentially be the challenges of conceiving through IVF?
I think the main thing is going through this journey, and sometimes patients are surprised. They say, I spent $15,000. You tell me you need 30%, 70% chance I'm going to fail. I think it's important to recognize that it's one cycle, it's one embryo or 2 embryos that we're putting in. So a normal couple who's very fertile, their chance of getting pregnant every one cycle is only 20%.
20%?
Yes, so that's why cumulatively you have to keep trying, and 1 year is about 80%.
Wow.
If you're trying naturally. So for IVF, the challenge is sometimes coming to terms with that because it's a bit of an emotional roller coaster.
Yeah.
You're investing on it, you're spending time on it. At the same time, you have to brace yourself for, am I going to be successful or not? So there's a bit of up and down. So that we try very much to help you go through the journey to be make it as pleasant as possible.
And what are the questions that you must have had when couples come to you for IVF? What are one of the most asked questions?
I guess a lot of time is, when they're successful, life is easier. But when they're not, then that's when they say, why? Why is it me? So a lot of time from science, what we understand is a lot of time is the embryo. So what we are doing is we are taking the egg and the sperm, but the quality of it, unfortunately, the limitation of science is we can't really assess totally the quality. We can only see from the outside, and we choose the best embryos to implant. So a lot of time is due to that, and we're trying to improve our choice, making the right choice. It's as though you're planting a seed on the soil.
Yeah.
You want the best one that's likely to survive. So because of our limitation, what we can do is we put it in, and unfortunately we have to let go and see, will it survive? We'll have to let nature tell us, is it strong enough? So a lot of time, unfortunately, women again bear the responsibility. They wonder, did I do something wrong? Must I lie down in bed? Or did I eat something? And a lot of time it's not that. The women are already doing their best.
Yeah, it's a couple thing, right? Guys and girls alike, men and women as well. Now listen, we've got a feedback form going around, so we'd love for you to fill that up. We've got some goodie bags for you to grab at the end of this session with Professor Yong. I'll also get questions and answers. If you got a question, let us know. Thank you, Celine. And if you have a question, you can SMS. The number is on to your right-hand side of the stage. If you're facing the stage, it's on the right. That's the number. If you want to text over a question, go ahead. We'll get the questions on board. And we'll start the Q&A as well, Professor Yong. Firstly, I've got a question here. What are the things we need to consider between IVF and IUI. Now, firstly, what is IUI?
Okay, IUI is a short form for what called intrauterine insemination. Basically, it's just inseminating the sperm into the womb. All right. So when you have intercourse naturally, the semen is inseminated in the vagina. So the sperm has to swim through the neck of the womb into the womb. So IUI is we help bypass the vagina and the cervix and we put it directly into the womb.
Okay.
Okay, but the sperm still has to swim through the fallopian tube to find the egg.
Yep.
Whereas in IVF, it's a very different process. So IUI is still fairly natural in the sense that the sperm have to find the egg and fertilize inside the woman's body. In IVF, the idea is that we have to retrieve the egg. So what do? Is we actually suck out the egg.
Yep.
And we put the husband's sperm together in the laboratories outside the body. So we can see that they have fertilized. We get the embryo and then we put it back into the womb. So it's a quite different process.
It is very different. I mean, you're taking the eggs out
That's right.
for IVF.
That's right.
And it's completely different for IUI. So what are the things that one would need to consider between these two?
A lot of time is we need to consider what's the reason. So for IUI, you need to have patent tubes. Means the tubes can't be blocked because otherwise the sperm swim and never get to meet the egg.
Exactly.
So that's the first priority. 2, the sperm must be of a reasonable quality because if the quality is poor and like very low counts, then IVF might be a better treatment. Sometimes some people have tried IUI and have not gotten where they are, and then that might be the next steps.
Okay. Questions, if you have any, they're coming in thick and fast now. The SMS number you can see on the board is 97764283. Our speaker at the moment as we start off our series for ILF children and your Know Your Fertility Wellness campaign is Professor Yong Tein with me. And here is another question. I got a few questions onto my iPad as well. And firstly, how long? Now this is interesting because we've talked a lot about IVF, in vitro fertilization. How long is the IVF process?
Okay, so well, it takes about 4 to 6 weeks. So if you imagine, I'm just going to use the IUI for you to compare. IUI is very natural. What we do is when a woman's menses comes, what happens is that in the ovary, the egg is start developing.
Yeah.
Okay, it's getting ready to come out, and they sort of compete, and the best egg will come out. So in IUI, what we do is we monitor and find out when is this egg big enough, so-called ripe enough, and that's when we put the sperm in so that they have a best chance of meeting. The timing is correct. In IVF, what happens is because we have to retrieve the egg, we want it more efficient because it is a procedure. So we try to, because every month you only have one egg, we give you injections so that you produce more. So we're aiming about 5 to 10, so your eggs will be enlarged. And then it takes about 2 weeks. So the injections is approximately 2 weeks, okay? And after that, we do a procedure where we retrieve the egg.
Mm-hmm.
So it's under sedation or in anesthesia. We put a probe in the vagina, and with a needle, we suck out all the egg. A procedure that takes about 10-15 minutes. We have got the egg now in the lab. The husband has to give us the sperm that day. They fertilize, and we wait. The laboratory will monitor in the next few days how's the fertilization.
So that takes about a couple of days or a few days?
It's from 3 to 5 days.
Okay.
So once it's fertilized and we choose the best egg, then we will do a procedure similar to the IUI in the sense that now we're going to put the embryo back into the womb. So it's about 2 to 3 days later, and then we wait. She might have to take some medicine to support the lining of the womb, and 2 weeks later she will know whether she's pregnant or not.
Wow.
So the main so-called activity is in the first 2 to 3 weeks. After that is taking it easy, waiting for results.
Okay, so that's your time frame for IVF. And will an IVF treatment be painful or uncomfortable?
Like say, a lot of women are afraid because they have to do the injections themselves. And over time, the good news is it's much more friendly. Last time was very difficult. They have to break vials. Nowadays, they come with a very nice pen. You just click and it's very easy. And you just inject it on your tummy.
Wow.
Yeah, so it's a bit like your insulin, but much easier. So a lot easier. So a lot of our patients say, no, no big deal, you know. So and then the egg retrieval itself, yes, a bit of pain, but it's a very short while. It's a very short while, and there is some sedation or general anesthetic. Sometimes during the embryo transfer, there may be some discomfort because what we do is when we put it in, we ask the patient to have a bit of urine so that we actually do it under ultrasound guidance. So we have an ultrasound on the tummy. So some patients say, "Ayo, it's very uncomfortable, my bladder is very full, why are you pressing on me?" So that's some complaint there. But overall, not much, I must say. Unless something unforeseen happen, of course.
So
yes.
not much discomfort.
Usually
not
not
too much
too much, yes.
And when is this is the question? When is the best ages for IVF for women and men? When is that time frame?
Well, the general thing is the younger the better. Okay, the funny thing is we have some patients who they think 35 is very old. No, I mean really. As a doctor, I'm very happy my patients under 34.
Under 34.
I mean,
okay.
that's the best results.
Okay.
But a lot of time they come about 36, 37. Please don't wait till 40. And in Singapore, we are not permitted to do IVF after age 45.
Oh, okay.
That's the law because the results are very poor.
All right, so that's
And-
stats that prove that.
Yes. And the men, again, younger better, but young men are more fortunate than women. The biological aging is not so fast. So whatever age is fine, but younger better.
All right, here's another question again from our text. And how can men give their sperm in the IUI process? How can men do that?
How can men
Give
give the
their-
IUI?
their-
Okay,
their- their sperm in the
okay,
IUI.
usually they produce the semen by masturbation.
Okay.
Usually in the hospital. Sometimes they bring it from home. So what they do is we give them a special container, and then the laboratory will process it, okay, to get the more fast swimming sperm, so that then it is what we inseminate.
All right. As you said, the laboratory can process it. Obviously, it's under the microscope, and you're looking at the various billions and billions of...
Millions.
Okay, millions of sperm altogether. And how many cycles or time can women go through IUI or the IVF?
I don't, in terms of time, IUI, I do not think there is a limit, but usually we limit in the sense that if it's not working, perhaps it's time to move on. So generally, it's about 3, the max 6 cycles. It depends on the reason why we're doing IUI. So for example, if a couple is young or the problem is they're not able to have intercourse, then we might try a bit longer. But if they're older, then we might want to move on a bit faster.
Yeah.
IVF, there are some restrictions by the government. All right, I think below age 40, not more than 10, and after 40, not more than 5.
Okay.
Okay, but the government funding is only for 3 cycles and before age 40. So to get funding, you must be before age 40. The women must be before age 40.
And you mentioned 3 cycles.
The funding is for 3 cycles.
Okay. Once again, you're joining us here at the I Love Children Know Your Fertility Wellness exhibition and campaign. It goes on today, and questions are coming in, and I've got a couple here in my iPad too as one. Here, what are the risks, Professor Yong,
Of IVF.
associated with IVF? Yes.
Okay, the main thing that we worry about, but very fortunately it's very rare, is the problem of what we call hyperstimulation because of the nature of the injection we give. So there are some women who are more sensitive and they produce too many eggs. So instead of 5 to 15, they might produce 30.
Wow.
Okay, so what happens is what determines that is her age, her weight, her ovarian reserve, and of course the dose of drug that we give. So that's why there's a lot of monitoring. When we start injection, she has to come every few days and we see how she responds. So some people respond too much, some people respond too little, and in a small percentage of cases we have to stop. We have to abandon it because it's either too much that we worry is dangerous or too little she's not responding and we think that carrying on will not bring us anywhere.
Yep.
So, but this is actually not that common, all right? So sometimes what happens is, like say, we still worry about hyperstimulation. We do what we call salvage, means we're already halfway there, we started the injection. So what we do is we retrieve all the eggs, we fertilize the embryos, but we freeze them.
Yeah.
We purposely do not want to transfer because we purposely do not want the woman to get pregnant for that cycle. That's because with the high hormones, it can cause what we call hyperstimulation, where water collect in the tummy or in the lung, and it can be quite uncomfortable. And so sometimes, so there can be serious consequences. And so, but this is salvageable. We will normally just freeze, wait for her to recover, and then later on put back the embryos.
You mentioned water retention in the
Yes.
lungs as well.
Yes, but
Wow.
those are the serious ones. That's
Yeah.
why we try to avoid this as much as possible. And the good news is nowadays with the medication, we actually can do it much better.
That's great.
Yeah, yeah.
That's awesome. And speaking about seriousness of IVF, what are the dangers of going through the IVF process? We talked about younger couples, but
Yes.
now at a later age, what are the dangers in response to this?
Well, the thing is, the age, yes, definitely the older women is, the worry is the quality of the egg. All right, and then the higher chance that we won't get pregnant, or if we get pregnant, we get miscarriage.
Yeah.
And of course, with older women, we worry about Down syndrome, high blood pressure, diabetes, all that sort of thing. So that's why generally younger better. The other risk that we do talk about is the fact that to improve the pregnancy rate, we normally put 2 embryos in. And so potentially, a woman, when she gets pregnant, she might have twins.
Oh.
Okay, generally the people like to have twins. They say 2 for the price of 1.
Absolutely.
But from an obstetric point of view, we prefer a single baby at a time because twins, most of the time they're fine, but they're higher risk of miscarriage, of what we worry is going to labor early. So instead of 9 months, they come out either at 7 or 8 months. And so then the baby may need ICU care. So because of that, for our young patients who have very good embryos, we normally ask them to put 1 at a time.
Yeah. Okay. And in regards to ART, are we entitled to subsidies for ART? And if we get a referral from the polyclinics?
Okay. When you get a referral from the polyclinic, because normally the first thing is you need to see a specialist doctor first.
Okay.
So your consultation, your investigations will be subsidized. But once you start IVF, meaning the injection and the tests that you do during that process, unfortunately it's not subsidized. And so what the government does is they give you the grant to help defray the costs.
Yes, absolutely. And of course, you mentioned about Medisafe, which can be used eventually.
That's right.
With the grant. How would we know if we need to go through IVF? I mean, we've gone through this topic over and over again.
It's right.
Especially for the women and for the men. How would one know that, okay, it's time to go for IVF?
I guess it's not something that you sort of know in your heart. It's a decision that you make. I mean, the problem with fertility is there's no certainty and no guarantee.
Yeah.
All right, so you try on your own. I mean, at least a year. You have tried a year or 2, and you have tried to see whether there are correctable factors. Is it the tube block? Can you unblock it? Is there an issue? So you have to work out where the problem might lie, and can this be overcome? Sometimes you treat it. If you overcome it, good, you conceive on your own. But if you're still not getting anywhere, ultimately the journey is about having a baby. You say, I want my baby. It's not like you tell me my tubes are very nice, but I still haven't got my baby. So this is a choice that a couple make together with the guidance of their doctor. So they have to take into consideration their health, their beliefs. I mean, financially, any issues, and see how to work towards it. So it's a choice that we make together.
All right. Again, welcome if you're just wondering what's going on here at the atrium at Chinatown Point. It's I Love Children and Know Your Fertility Wellness that's begun today. And Associate Professor Yong Tein still with us on the stage. Another question that came off the SMS system. How to improve the fertility in men?
Okay, I guess...
This will probably be the last question for the day.
All right. One is have sex more often.
All right.
Okay, it's a very common thing now. Singaporean, they said we're very busy, very tired, and so basically for men, when we do sperm count, we always call it a sperm test. So the men seem to think like, did I pass the test or not? It is not. It is just the sperm test will tell us the numbers. As long as there's a sperm, there are sperms, there's a potential to get pregnant. Very rarely we have men who have no sperm, and that's a different problem altogether.
Okay.
So first is, and the other thing is to deliver the sperm. All right, they have to have a chance to meet the egg. And so sometimes couples are very worried. They said, must I have sex only at a certain time when I'm ovulating? And the idea is that when you have intercourse, you're delivering the sperm, and sperm can survive a bit longer. So you're delivering it to the egg. So there's a chance. Now, the other thing is, of course, don't smoke. Don't drink so much. Not to be too overweight. Have a healthy lifestyle. Yes. I mean, no drugs, This as best as you can do. I mean, have a healthy lifestyle. I think there's so much one can do.
I see the positives in there for men especially. Well, what is the takeaway message, Professor, would you like to share with couples who are here today and those who have signed up for the talk? And
I think the main thing is that one is a journey, and it does require some courage. But I think the thing is to start, to not hesitate, to seek help. And if you don't agree with something, ask for an opinion. I think nowadays with internet, with another doctor, if you're not sure, the thing is do not be ambivalent. Find it a hard decision to make, then deter, because age, it is a very important thing. And we see that the government is trying to help. So do garner, take all this help to help yourself.
all right.
Yes, and don't wait too late. That's the main message. Don't wait too late.
Don't wait too late. Don't wait too long. Again, we stressed as much as we can. Once you get married, next again, have babies, whilst you're on your honeymoon. Why not? That'll be a great chance too as well. And go for fertility health check and seek timely treatment to optimize your chances of conception. Now, once again, if you're wondering what the kiosks are, there's one over there, and the iPads are all around. You can sign up for the I Love Children Fertility Health Check. Once again, please, a big hand for our first guest this afternoon, Associate Professor Yong. Thank you very much for being here, Associate Professor Yong Zhi Yan.